Hello! If you are watching this video, it means you are about to embark on an amazing journey, traveling to one of Harding's worldwide study abroad programs. Traveling around the world can be exciting and fun, but all of us at Harding's International Programs Office want you to be safe and healthy during your time abroad. Hopefully this video will help answer a few questions you might have about staying healthy while you travel and prepare you for situations you might come in contact with. We hope you enjoy this special video.
Hello, I'm Dr. Mike Justus, a family physician and member of the Harding University Board of Trustees. Because you are watching this video, I know you have a special interest in the International Studies program at Harding University. If you're a student, I feel certain that your semester abroad is going to enrich your liberal arts education and will offer you unlimited opportunities for both social and spiritual growth. And if you're a parent or a grandparent, while you may be supportive of the International Studies program, you may also be just a bit anxious about risks for your student in the global community. My wife and I have 3 children who participated in the study abroad program while they were students at Harding. Each one chose a different campus: Italy, Greece, and Australia. But no matter their destinations, we were always concerned about their health and safety while they were away. This video offers a few recommendations to help alleviate some of your anxiety and to promote health and hygiene while they are traveling. Most of the suggestions are common sense, but we hope this information will allow you plenty of time to update immunizations, discuss high-risk behaviors, and seek advice from your personal physician about specific health needs. The administration, the faculty, and the Board of Trustees are all committed to helping you explore Harding's worldwide community of mission. And no matter where your studies take you, we pray that God's hands will protect you while you are experiencing the world as your classroom. And so we wish for you a very safe and healthy journey.
We're now going to answer a few questions you might have or you might be thinking about before you study abroad. Dr. Justus is back with us to answer these questions. Thanks for being here.
My pleasure.
All right, so the first question. I've just signed up to study abroad. I'm excited. I can't wait to go on the exciting adventure that I'm going to go on. But what can I be thinking about now, maybe a few months or even a year before I go on? What precautions can I take now?
It's a great idea to start thinking way ahead of time. And to try to know as much about your destination as you can in advance is always to your advantage. The other part of that is, even though you're going to wind up at one place in the world, you want to take a look at how you're going to get there and how you're going to get home as you pass through other countries along the way, so that you know about risks that are there. One of the resources that can be really helpful is www.cdc.gov, which is the Center for Disease Control website that has a whole listing of travelers' health information, including country-by-country designations of concerns, outbreaks of illnesses, additional immunizations, whatever you may need. So looking at that website way in advance can give you a leg up on the whole process. The other thing is to take a look at your insurance coverage, because the policy that you have for domestic coverage may not extend internationally. Now, the program here may offer you an opportunity to extend that, but you can certainly shop around. There are a number of companies that will make that available, and you want to be sure that you have that when you're traveling.
That's great. A lot of times you might think, I'm just going to Greece or I'm just going to Zambia, but you're going to be traveling to a lot of other countries on the way, or even there when you're visiting other countries. So that's some great advice, some great things to be thinking about. And then another question, a lot of times students wonder, should I visit a doctor before I go abroad, or are there any immunizations that I need to take? What is your take on that?
I think it is helpful to talk with your primary care provider, particularly if you have chronic illnesses, which are going to require that you take with you medications that have to pass through the TSA line or even entering customs in other countries. So it's helpful to have on a physician's letterhead an explanation of why you're on the medicine, the exact name of the medication, the dosing, all of that. And you can present that. You don't ever try to hide that from the inspecting people. You just lay it out there, you have your letter, and it's all very, very official at that point. The other thing is, some people have a bit of anxiety when they travel. whether it's on the plane or whether it's in crowded conditions or unknown roommates or whatever it is. But it's worth talking to your physician ahead of time about if I'm in that situation, is there something I should take to make this travel much easier? Those would be two immediate reasons. Of course, you can talk about the other things, and you mentioned vaccinations, and we'll just go there now. It's important that you look at your routine immunization schedule. Some of those things require boosters, like a tetanus booster. And if you're between age 18 and 65, there's a particular form of tetanus called Tdap that should be given once. If you've had that, then it's just a matter of having your tetanus updated every 10 years. Your physician should know that, so they should be able to look that up for you. The other immunizations, measles, mumps, rubella, those kinds of things, should already be logged in. You should be able to take one look at that and know whether you're adequately covered. And then you move into the seasonal things. Certainly influenza can be year-round because the climate is different in different parts of the world where you're traveling. So you want to be sure you've had an influenza immunization within the 12 months prior to your travel. Then you look at the risk concerns, and that would include typhoid and hepatitis A, which are two immunizations that should be considered before travel. Both of those tend to be food or water transmitted. So no matter where you are, you're at risk for those. The hepatitis A immunization series is a 2-shot immunization. So that means you get the first one, and then the second one is 6 months later. So the earlier you start on that, then you assure yourself you have enough time to get both immunizations. Typhoid coverage comes in two forms. You have oral or you have injectable. The oral is a little more difficult to take because it's every other day for 4 days, but the immunity lasts about 5 years before you have to update. The injection is updated every 3 years. And then the big one that everyone is concerned about, and it's why I encourage you to have this, and you can get this from your primary care doctor's office or whoever gives immunizations, is yellow fever. It's imperative that you look at that CDC website and know what countries that creates a risk, because the immunization requires a stamp. When you get the shot, there's actually a little sticker that goes into this booklet that you keep with your passport that shows that it was given, where it was given, who gave it, the date, all of that. But it's not just the country where yellow fever is a problem. If you have passed through a country getting there where yellow fever is a concern, you'll have to show proof that you've been immunized before you're allowed to be in. So those would be immunizations that would be right at the top of the list, and you certainly want to talk to your healthcare provider about those.
Definitely. So it would be beneficial to go at least a few months in advance,
Exactly.
if not maybe 6 months in advance, so that if you do need any of those immunizations, you can get them done before you travel.
That's true. And if you're not sure whether you're adequately immunized, you can have a blood test that checks the titers to see if you have enough antibody on board. But that also, you need to do that in advance, because if you're not adequately immunized, you need time to get the immunizations.
Great. So we'll definitely be thinking about that before we go on an abroad trip. And then if I'm abroad and if I get sick, what do I do? Are there doctors that I can go to, or is there a cause for concern if I get a cold or if I get the flu? What would you best recommend for that?
It's a great question, because there's this tendency, once we sort of leave the country and we've been out there for a little while, we start feeling a little invincible, and that, you know, nothing will affect me while I'm away. I think that's imperative that we travel with someone. It's much, much better if you do get sick that there's someone who can manage the situation or seek help for you if you need it, or if you're in an accident or whatever. There's another website, www.usembassy.com, that you can Google, and it will give you the address and the phone number and the location of the consulates and the embassies in every country in the world. And so you can type that in, download that information or print it off, so that you know the countries that you're going to be visiting, and therefore you've got access to those agencies who know the reputable providers of health care in the area and can assist you with that as well.
Another great thing is we have wonderful staff members that are at all of our programs, and they are more than welcome to help any student who gets sick. So if they're on free travel, they can definitely go on that website, or if they're at their primary location, they can talk to any of those staff members. So that is great as well. And then just general healthiness. How can I stay healthy when I am traveling from country to country so much?
Let me talk about some generalities, and then we'll talk about specifics if you like. Okay. I think the first thing that always comes up is probably hand washing. And we can't emphasize that enough. And you think, well, soap and water is the answer to that. But then you think, well, what if soap's not available? And what kind of water am I washing my hands in? Is it actually disinfected enough that that doesn't create a problem? So hand sanitizers should always be a part of carry-on everything, or put it in your pocket, the alcohol-based ones. And you want to be sure that you're using that before you eat, after going to the toilet, when you've been in a crowd where you're touching banisters and things where people have had their hands. And one place that we don't think about often is on the airline itself, the tray table. Because you know the people who service the cabin do not take time to wipe down all of those tables. So if you have the alcohol wipes with you, just take a minute and wipe that down, because you're going to be sitting there for hours, and you can minimize some risk there as well. I think the next thing that comes up is water. If you're going to stay healthy while you're away, you want to be sure that you're drinking water that's not infecting you along the way. And while this looks good, if you check this, this has already been opened. And there are places in the world where empty plastic bottles are refilled from a tap. The cap is put back on and it's sold. So you want to be sure and check the seal, be sure that it's not already broken before you drink the water at that point. This is a fun thing for those of you who happen to be adventuresome about this. This is a SteriPen. You can buy this online. Any adventure catalog or whatever will sell this. But the nice thing about this is it works on ultraviolet. The mechanism for sterilizing water or disinfecting water is based on ultraviolet theory. And that is that if you have water that you're not sure about, you take this, and it has a battery in it, and this cap comes off, you put it down in your Nalgene bottle, you hit the button, 30 minutes, it gives this intense ultraviolet light, and it will disinfect the entire bottle of water. So if you have any question about whether the water's potable or not, this carries with you. It'll do 100 times on a battery. So
that's
it's a
awesome.
terrific little device, a SteriPen there. Then we moved from water to food if you want to stay healthy, and that's where hepatitis A and typhoid comes in again. And the old adage, you know, if you can't boil it, peel it, cook it, then forget it, really comes into play here. And some folks just love street vendor food, but you have to know that you're taking a risk when you do that. And the whole fallout from travelers' diarrhea and the discomfort and the loss of time while you're traveling is hardly worth that. So in a really weigh the risks for that. I think we don't talk about it much, but shoes are an issue. Flip-flops really don't belong in any place but the shower. Hiking in a flip-flop is a twisted ankle or a broken bone, you know, just waiting to happen. On the plane, because you're locked into that seat for a long period of time, you want to move when you can. The risk for a deep vein thrombosis or a clot in the calf goes way up the longer you're sedentary. So if you can't get up and get around, you're stuck in one of those middle seats, then just pick up your feet and move periodically, or pump your feet so that you stimulate the vascular movement in the legs. And then the last thing, and we probably don't need to talk about this because it's part of the program that you agree not to participate in alcoholic beverage consumption while you're away. But there's another reason for that. It offers no nutrition, it contributes to dehydration, and it does impair judgment, which can be, if you're driving a vehicle, can put you at risk. If you're a pedestrian, you may step out into traffic because it's going the opposite way that you would normally expect, or it can leave you with more dire consequences of sexually transmitted disease or even pregnancy. Okay.
In cities and countries that we are not familiar with, we definitely want to be as safe as we can, so using these precautions will definitely help all of our students. And then finally, what healthcare items do you recommend students taking with them when they study abroad? Do they need to bring ibuprofen or other normal pain medications, or 3 months of prescriptions? What do you recommend?
It's a great question, and I have a little show and tell here,
yes,
if this is okay. And so we'll just kind of go down the list. We've talked about water already, so we'll just move that aside here. There are several things that you can think of, and my little checklist usually is a family of antis. It's anti this, anti that, anti that. So if you start thinking in that, what do I need to take with me that's going to protect me in that regard? One thing that you should put together before we get to the medicines is just a little first aid kit. And there's really not much in this but gauze, tape, and I'm high on Coban. So if you don't use this, this is a self-adhering bandage. So instead of an ACE bandage where you have to use clips, this sticks to itself. It weighs nothing. So you can pack this in your backpack and make it very, very easy. Then if you move through this anti-group of things that we have here, this is an antibiotic, Neosporin, triple antibiotic, tribiotic, any of those are fine. Small tube lasts a long time, but for cuts and scrapes, it's very, very good to have around. This is an antifungal cream. This is for athlete's foot, jock itch, those things that we get from travel, where we maybe not having a chance to shower often or we haven't laundered clothes for a while. This is helpful to have around.
I think the laundry thing is a big deal.
This is an example of something for anti-diarrhea. Traveler's diarrhea is very incapacitating. If you've saved up, you've waited for a trip, and then you just can't participate in anything because of abdominal discomfort and the inability to find a bathroom when you need it. Pepto-Bismol is one of those things that's been around a long, long time, but it is helpful with traveler's diarrhea, or you can go to more prescription drugs, Lamodal, Imodium, those kinds of things. You do have to be careful with those that you don't trigger a constipation and you prolong an infection. I would mention one thing about Pepto-Bismol. If you opt to use this, it turns your tongue black, and so you shouldn't be anxious or surprised about that if that happens. Okay. This, an antihistamine, Claritin, Zyrtec, Allegra, Benadryl, all of those are in that category for allergy issues, for bee stings, those kinds of things. And in a pinch, Benadryl works to help you sleep sometimes as well. So this is another anti that you want to have around. This is an anti-nausea or anti-vomiting medicine. This is Zofran. And I would point out here, one of the reasons this box is sort of beat up here as you look at it, because it's traveled with me so many times, but it is labeled. So anything that's prescription drug should have your name on it and the prescriber's name on it, so there's no question about it being taken away from you. But Zofran is nice. It can actually melt on your tongue, so if you're stuck somewhere and you're nauseated or about to throw up, you don't have to look for water to take this as well. The antibiotics, azithromycin is a drug which has broad spectrum. And when you're traveling from country to country, airport to airport, you're exposed to a lot of respiratory things. You should talk to your doctor about whether this would be a good choice for you. One of my favorites to travel with is Cipro. And the reason for that is I tell patients that you just draw a line across the abdomen. Diseases that are above, such as a sinus infection or a respiratory infection, you take it twice a day for 7 days. Diseases that are below, traveler's diarrhea, urinary tract infection, you take it twice a day for 3 days. So traveler's diarrhea would fall into that, and so therefore it becomes sort of a universal medication there. This is Tamiflu, and we've just come through one of the worst flu seasons. You know that on campus here. This is worth taking with you if your physician agrees, because again, the flu season is different in different parts of the world. If you know you've been exposed, you take this once a day for 10 days. If you actually develop the symptoms, it's twice a day for 5 days. So it becomes very useful in that regard as well. You mentioned pain medicines. Certainly Tylenol is easy on the stomach. Ibuprofen is over the counter, comes in a liquid gel, which is easier on your stomach. Aleve is another option that you can take with you as well. We mentioned hand sanitizers. Certainly that's another one of those anti-germ things. So we're still in the anti-family here. And then this is anti-sun. Which is the SPF factor in sunscreens really should be between the 30 and 50 range. And you do need to read the fine print to be sure that you're being screened for A and B, both, UVA, UVB. Because while one will cause you to look red, the other can be burning and you not notice it so much. And then chapstick or lip balm of some sort can be helpful as well.
Those are important because most of our programs go outside a lot, so we'll definitely need those.
I'd like to mention one more thing, which is not a medication, but which you might find helpful, and it comes right off of this sun thing. In the Mideast, the shamag is a very, very helpful device. Looks just kind of like a headscarf, but it has a multitude of uses. And if you put it on like this, you put it like this, and then you tie it in the back, it now filters out dust, wind, pollen, sun, if you're stuck out without a hat, and you can pull it back, you can tie it on as a scarf. It wads up as a great pillow on the plane, and you can even tie the corners up and make a little knapsack out of it. So it's 42 inches, I think up to 44 inches square, so you can make one of these, you don't have to buy it.
I wish I would have known about that before I went abroad. That's awesome. Well, thank you so much. I hope that these questions help students, relieve stress and feel more confident before they spend an amazing semester abroad.
Well, it's been a pleasure talking with you, and if anyone is listening, I know they can contact your office and they'll be able to find more information there.
Yes, definitely. Thank you so much for being here.
My pleasure.
Students, we are excited for your trip. We're excited for you to go abroad, but just make sure you remember everything that Dr. Justus told you today so that you have a safe and healthy trip. Thank you.